Venous thromboembolism is the leading preventable cause of death in hospitals across the world. Every year, 10 million people develop venous thromboembolism, or VTE, and in the developing world, few of these patients receive the therapy they need to survive. VTE begins with the formation of a blood clot in the deep veins of the legs, which occurs most often in patients who have just had surgery or given birth. When the clot breaks off, it can become lodged in smaller blood vessels in the lungs or the brain, blocking circulation with debilitating or fatal effects. Current methods for preventing VTE in the developed world require too much monitoring, like drug delivery, are ineffective like compression stockings, or are too expensive like compression devices to implement in low-resource countries. In fact, intermittent pneumatic compression devices cost, on average, $4,000. As a result, there are no sustainable solutions to prevent VTE in the developing world. Our team, ClotMeNot, has spent the last 1.5 years developing the PneumaShoe, a low-cost, durable solution to prevent VTE in low-resource settings. We worked hand in hand with physicians, nurses, and patients in Malawi to ensure that our device can successfully be implemented in low-resource settings like Malawi's Queen Elizabeth Central Hospital. Our device works with a control box powered by a microcontroller. The process begins with a diaphragm pump that pressurizes field-repairable air tanks made of soda bottles. Once pressurized, solenoids open, allowing air from the tanks to rapidly fill 2 reusable foot cuffs. The cuffs are then deflated using 2 solenoid exhaust valves. The PneumaShoe is shown here inflating through a 20-second cycle to apply therapeutic pressure to the plantar plexus of the foot 3 times a minute. 2 pressure relief valves prevent overpressurization. The easy-to-use adjustable cuff would be worn for 18 hours a day while a patient is bedridden and can easily be cleaned and reused for the next patient. The PneumaShoe reliably meets literature and market-based therapeutic standards for pressure application, inflation time, and frequency of inflation, while also meeting safety standards for maximum pressure. Its adjustable, reusable foot cuff fits a wide range of foot sizes, while the device itself is compact and portable. User testing demonstrated the PneumaShoe is quick and easy to set up and use, while also scoring highly in patient comfort. The PneumaShoe has not yet been shown to meet the desired 2-year lifespan and has not been tested in the full range of temperature and humidity use conditions due to the time limitations. However, the device can run continuously for an extended period of time. The current PneumaShoe costs $560, but projected at-volume cost is $177, a 95% reduction from current marketed devices. The PneumaShoe will travel to Malawi for testing and feedback and continue to be developed to further expand its applicability, allowing it to provide global access to a critical medical treatment.